Today, we're jumping into a real medical head-scratcher, a paradox that seems to break all the rules, something called hepatorenal syndrome.
So let's get right to the heart of the mystery. You've got a patient whose liver is failing, which is obviously a huge problem. But then something else happens. Their kidneys start to shut down. And when doctors look at them, the kidneys themselves look perfectly healthy. So what in the world is going on? How can a healthy organ just decide to quit?
All right, let's put on our detective hats. We're at a medical crime scene. The victims, the kidneys. But when we examine them, there's no smoking gun. No signs of injury, no damage, not a scratch on them. They look completely innocent. This is a very strange case.
And this brings us to what's officially called hepatorenal syndrome, or HRS. Now, the key words here are what make this whole thing so fascinating. It's functional failure, which just means the kidneys aren't working right, not that they're broken. It's also potentially reversible, and that is a massive clue. And the biggest clue of all, the kidneys are structurally normal. They are innocent bystanders caught in a crisis that started somewhere else entirely.
So let's boil it all down to one simple idea. The kidneys haven't been damaged, they've been starved. They are literally being choked off from the blood flow they need to do their job, filtering out all the bad stuff. The problem isn't the kidneys themselves. So the real question is, where's the problem coming from?
Well, all of our evidence points to one prime suspect, the failing liver. It's the one that pushes over the first domino in a chain reaction that ultimately takes the kidneys down.
And that first domino is something called portal hypertension. See, when you have severe liver disease like cirrhosis, the liver gets all scarred and hard. Blood can't flow through it easily anymore. It's like a massive traffic jam. This causes a huge pressure backup in the main vein that drains blood from your stomach and intestines. This incredible pressure is the trigger for everything that goes wrong next. And this is where the plot really thickens. It turns out the liver isn't acting alone. The real problem is the body's own survival instincts. The body tries to fix one problem, but in doing so, it creates a much, much bigger one. It's an unintentional conspiracy against its own kidneys.
So here's how it all goes down. That high pressure in the gut makes the blood vessels there get super wide, and blood starts pooling. The body's ancient alarm system can't tell the difference between that and, say, a massive bleeding wound. It panics. It thinks you're losing blood fast and flips on the emergency sirens. Powerful hormones are released with one single mission: squeeze every blood vessel in the body shut to keep blood pressure up. But here's the tragic mistake. This system-wide clampdown is so extreme that it squeezes the arteries going to the kidneys shut. Blood flow just plummets, and the kidneys, starved of oxygen and blood, are forced to shut down.
Now, this syndrome really has two different faces. You've got HRS acute, or type 1, which is just a terrifyingly fast collapse of kidney function, often kicked off by something like an infection. Then there's HRS chronic, or type 2. This one's a much slower, steadier decline. Both are incredibly serious, but that acute form, that's a 5-alarm fire. It is a life-threatening emergency.
So, with all this going on, how do doctors actually prove that HRS is the bad guy here? Well, it takes some serious detective work. See, there's no single test for HRS. It's what's called a diagnosis of exclusion. You have to prove it's HRS by first proving it's not anything else.
And this is the official checklist the doctors have to go through. First, you have to have liver cirrhosis and fluid in the belly, called ascites. You have to confirm it's a true acute kidney injury. Then the process of elimination begins. You stop diuretics, give them some IV fluids, and if the kidneys still don't get better, you're getting warmer. You also have to make sure the patient isn't in shock, hasn't taken any kidney-toxic drugs, and, this is the big one, that an ultrasound and other tests show the kidneys look totally normal. Only when you've crossed every other suspect off the list can you finally point the finger at HRS.
And one of the best clues for telling suspects apart is found in the urine. Let's say we're trying to decide between HRS and another common cause of kidney failure called ATN, where the kidney is actually damaged. Well, in HRS, the body is screaming at the kidneys to save every last molecule of sodium to try and raise blood volume, so almost no sodium comes out in the urine. It's super low. But in ATN, the damaged kidneys are leaky. They can't hold on to sodium, so it just pours out into the urine. This one simple test can be a huge giveaway.
Okay, so the case is cracked, we have our diagnosis. But now, the clock is absolutely ticking. The intervention becomes a desperate race against time to pull the patient back from the brink.
So what's the game plan? The first thing to understand is that these treatments aren't to cure, they are a bridge. The only goal is to keep the patient alive long enough to get a liver transplant. So first, you find and aggressively treat whatever triggered the event, like an infection. Then, you basically fight fire with fire. You give powerful drugs that constrict blood vessels, along with IV albumin. This combo is designed to reverse that massive widening in the gut, which hopefully signals the body's emergency systems to stand down and stop strangling the kidneys. If that doesn't work, dialysis can be used as another temporary bridge.
Because here's the hard truth. You can manage the symptoms, you can sometimes even reverse the kidney failure for a little while, but you can't fix the root cause. The only definitive, curative treatment for both the broken liver and the hepatorenal syndrome it created is a brand new liver.
And if you want to understand just how high the stakes are, look at this number. Without treatment, the median survival for someone with acute type 1 hepatorenal syndrome is less than 2 weeks. It is one of the deadliest things that can happen to a person with liver disease.
For the more chronic type 2, the outlook is a bit better, but let's be honest, it's still absolutely grim. A median survival of around 4 to 6 months. It just hammers home why that liver transplant is everything.
So that leaves us with one final big question. We've solved the mystery for today. We know the liver is the culprit that starts the domino effect. So the challenge for the future is, can we get smarter about this? Can we create therapies that stop that first domino from ever falling and keep those innocent kidneys from ever getting caught in the crossfire?